what you said there for the cervical spine section, I'm just thinking about concussion and the inclusion of even just social determinants of health in the past few years. We're using questionnaires just to really kind of understand. And, I've been preaching this for 10 or 15 years of, you have to understand where the patient's at when they're coming into your clinic or you're going into their home or office if you're doing home treatments. And, again, if the patient is going to be losing their home or their job or their health insurance in this country, we don't have public health, are they going to really be able to accept your treatment? And I think that's such an important thing to talk about when you were talking about with stress inoculation and just stress and things like that. And then also fatigue. I mean, the fatigability of those cervical spine, those intrinsic muscles. It's so interesting. We were just at a Liberty game the other day and it was like, okay, or even like the fifth set, tie break at the French Open. It's like, you really have to train. Like, how do you train for that, right? You really have to like run a marathon, get so fatigued cognitively and physically, and then go serve, 120 miles per hour and play in the heat. And it's the same thing with kind of training folks with concussion, is that we find that they're either their neurofatigue or their fatigability physically, cognitively